Support for This News is So Gay comes from the LGBTQ Plus Opportunity Fund of the Cleveland Foundation, leveraging philanthropy to empower LGBTQ Plus communities. Welcome to This News is So Gay. I'm your host, Ken Schneck, editor of The Buckeye Flame, Ohio's LGBTQ Plus newsroom. Thanks so much for joining us. Here's what we've got on this week's all-new episode of This News is So Gay. Despite my being an unabashed, though at times I'm kind of mortified about it, Bravo-holic, this will be our first time talking about the Real Housewives in 40 episodes. How did the Real Housewives find their way onto This News is So Gay? We'll find out. There are threats to HIV funding all over the country. Where are some regional providers seeing these effects? State legislatures continue to prioritize anti-LGBTQ plus legislation over bills that would help us buy, groceries and gas. What are some of our siblings in other states seeing with that anti-LGBTQ plus legislation? And of course, queer joy. Where is our roundtable finding queer joy in the news right now? Joining us this week to answer those questions and so many more. Reporter covering how LGBTQ plus people navigate the American healthcare system for the 19th, which is an independent nonprofit newsroom reporting on gender, politics, policy, and power. And I will always say a roundtable member for our very first episode of This News is So Gay all the way back in July, Orion Rummler. Orion, welcome back to the podcast.
Thanks so much, Ken. Great to be here.
Did you change your beat? I feel like there's a difference.
It was more bureaucratic than anything else.
Okay.
Like I was an LGBTQ reporter before, but focusing on health made more sense for me. And I kind of was already doing that. It's been great for my mental health to just focus a little bit more.
Say no more. I love that. And also joining us, Steve Elkins Fellow and White House Correspondent for The Washington Blade, covering LGBTQ plus news, culture, and community stories across Washington, D.C. and so far beyond. Joe Reberkenny. Joe, welcome back to the podcast.
Thank you so much for having me. I'm so excited to get into the headlines.
Now, I will say, Joe, you've gotten many shout outs since you've been on the show because I cite you as having hate crimed me when you talked about a classic film and it turned out to be Trick. We're still working through that, Joe, but I feel that we're going to get there. For right now, our LGBTQ plus reporters roundtable is now assembled, so let's dive in. We're going to start where we've been starting every single week. How are queer journalists doing? Orion, how are you doing?
I'm doing great. I mean, I did cut my hand in a woodworking incident this weekend, but me and my partner just saw Mae Martin perform in DC last night, so that was great.
That was great. Now, what were you making?
I was literally trying woodworking for the first time, so I wasn't even making anything. I was just using the new tools I got in the backyard. I was home alone, and then I cleaned everything up, and my partner was thrilled when he got home.
Okay. All right. New hobbies for everyone. Joe, how are you doing?
Tired. That's the best word I can use. Doing all right. It's just a lot to cover, a lot of news with one person being the federal LGBT reporter for the Blade. There's no shortage of news ever, which is good, but also exhausting. So last night, I think I slept for more than 8 hours for the first time in 2 weeks. It was lovely. And I'm already dreaming about going back to bed.
I love it. Yeah, I can't even imagine. It's such a privilege to be able to focus solely on Ohio. And even then, we're not even near hitting the capacity for stories. I can't even imagine covering Washington, D.C., but we're going to get to some of that. You both wrote about the Real Housewives of the Bravo world taking to Capitol Hill in March to talk about threats to HIV and AIDS funding and also PrEP access. First question, are you two Real Housewives fans, Orion?
I've never seen Real Housewives or any Bravo show. I'm a fake fan. But before going to the Hill, where Joe was also there, we both went to the Hill for this event. Before I went, I phoned a friend. I phoned my friend Viv. Vivian has seen all of Bravo, all of Real Housewives, and I was like, this is really important. I need you to tell me about these housewives that are going to be there. So I did homework, but I've never seen it. I'm sorry.
You could have called me. I would have helped you in a heartbeat. Joe, a Bravo-holic, did you know the Real Housewives?
I did. Honestly, didn't begin from actually watching the show. It's because of the gay mannerisms that me and my friends have. All of the little phrases, white refrigerator, Nene leaks,
Oh, yeah.
and like, baby, there is no plane. All of those little things finally accumulated into one of my friends, Jason, sitting me down and saying, all right, we got to watch it. And I have been, I have not seen every, series. I am a staunch supporter of the Real Housewives of Salt Lake City. I have now seen Meredith Marks DJ, and I just love the chaos that they bring and the drama. And yeah, I will say I'm a little bit of a Bravo fan now. Yeah.
I watched the first episodes of Real Housewives of Rhode Island this weekend. I'm not sure how I feel yet. We'll see. We'll see. Well, this is actually the first time in our 40 episodes that we've had two reporters who were at the same thing. And so I kind of want to put you into separate isolation booths and compare notes and see if you saw the same things. Joe, we'll start with you. What did you witness when the Real Housewives were on Capitol Hill? What was that energy like?
Yeah. So actually, this day was pretty busy for Capitol Hill. I was also covering the Save Act protest that was going on. So there was a lot of people, a lot of places doing a lot of things. I first showed up, had to go into it was more of a public panel that the housewives were doing where some people were asking questions in the Kennedy room over on the Senate side. Beautiful room, ornate, perfect for a Real Housewife to show up to. And it was overwhelming, I will say. It was good. Got a few good answers in on video. And then I had to go hop to the other protests, but then went into the private kind of journalists only with the Real Housewives. And that was quite honestly fantastic. You got to get super close to them, got to like take selfies, which are on my Instagram at Reberkenny Reports, if anybody wants to check them out. They all smelled so good. They all acted so kindly. There was no table flipping, no wine throwing. It was a truly lovely evening. And they all had such passion for expanding HIV funding and AIDS PrEP for everyone. It was lovely.
So this is kind of fascinating, Orion, because you don't have this history other than the briefing, which I'm sure the briefing you got from your buddy was amazing. So without this history on the Real Housewives and their mannerisms and all of their cultural phrases, what did you witness? Because for you, this people that you know have some influence, but not necessarily in the way that you knew them intimately.
Yeah, no, this was a very serious event because my editor, Terry, who's a Real Housewives fan, whenever I first filed, she asked, like, well, was there any shade? Was there any drama? And I was like, no. This was like a very serious event. And pretty much all the housewives shared a personal story about how, like, why they care about this issue. Like, a few of them said they had loved ones who had died, like family, friends. And then Nene shared a story that I really appreciated where she said after her husband passed, like she was having a conversation with her girlfriend, and her girlfriend, because Nene was dating, and her girlfriend was like, well, are you getting tested? And Nene shared that very candidly to the group, at the event, like the public event, and was like, I'd never thought about that before. So I found it to be a very like serious and also heartfelt event. I thought they were all a lot more well-mannered than some congressional panels with like members of Congress.
It's a low bar, Orion, but yes. And I have to just pause here because I am, for fear of giving Joe more ammunition against me from my childhood, I have to highlight the intersections of reality TV and talking about HIV because there was nothing bigger for me growing up than Real World San Francisco. And when Pedro Zamora was one of the housemates on Real World San Francisco, out with his HIV status, and when he passed away, I think it was right before it all premiered, and President Clinton actually went on prime time to give an address about the death of Pedro Zamora. And think about, although I guess maybe right this second, it's not a stretch to think about the president giving a primetime address on a reality show. At the time, to have a president talk about the death of a reality show individual was so huge. And I know, Orion, I was reading a piece of yours that was incredible of placing this in a wider context. The threats that the Real Housewives were talking about, can you talk to us more about what those threats to HIV funding look like nationally?
So the broad view, like the big picture is that a lot of the federal cuts to healthcare funding that the Trump administration has put through, and also through Congress through the Big Beautiful Bill, those cost-cutting measures have, trickled down to states. a lot of states are struggling with their healthcare budgets. And because of that, we have red states and blue states who are cutting back on their state ADAP programs and their AIDS drug assistance programs. So it's just red and blue states are cutting back on services for low-income HIV-positive Americans. Florida was doing something really extreme that we can talk more about later because Florida has, after there was a lot of outcry and backlash, Florida has since walked back their most extreme policy they were going to do. But broadly speaking, states across the country, they're struggling to pay for their healthcare. And a lot of them were responding to that by cutting their programs that help get HIV medications to low-income people.
And so that's nationally. We are going to now talk about more regionally because there are cuts that are affecting specific locations and specific states. We haven't totally seen that here in Ohio. We've certainly felt the threats, but we haven't seen the cuts manifest in a way that we thought they were going to. Joe, you wrote a truly important piece about the Ending Transmission of Sexual Infections, ETSI, Health Clinic in Portsmouth, Virginia. Tell everyone how that clinic is doing.
Yeah, unfortunately, that clinic is not doing too hot right now. They're facing a lot of funding issues and setbacks. The founder, Nonona Byers, fantastic trans woman who has really dedicated her entire life at this point to helping her community in Virginia get these HIV rates down and just expanding education and expanding testing in one of the highest rated HIV areas in Virginia, is consistently facing funding denials and loss of private funding, mostly tied to this broader funding crisis related to DEI rollbacks that is coming from the White House down, where really a bunch of governments are saying we have been told we don't have to fund this. And if that can balance a budget, they're pushing it. And it's really risking operational costs for life-saving medication and treatment for people across the state. It's really rough.
And Orion, you mentioned Florida earlier. There were some hardcore threats to end funding for HIV meds. What happened there? And how did those threats affect people?
Oh, yeah. I mean, this was a really big deal because in Florida, over 10,000 people were at risk of losing access to HIV drugs. These were a lot of low-income people. And when I was talking with experts, it was just a question of where are people going to get their medication after this, because, without getting too far in the technicalities, Florida had lowered their ADAP low-income program eligibility. They'd made it harder to be eligible to get these medications, to get these services. And they had lowered it to a degree that no other state was doing. All these states that are struggling to fund their healthcare budgets. So 10,000 people were at risk. Technically, they still are, but we're going to see what will happen, because right now, all those people, their access is protected at least through the end of June, because we've seen Governor Ron DeSantis, he signed a bill back at the end of March. It will extend access for low-income Floridians to get 3 more months of their essential HIV medication. So HIV advocacy groups, they still celebrated this because something is better than nothing, but it still remains to be seen what will happen after the end of June.
And those threats just affect people. We know that here in Ohio, we have different individuals trying to put together networks to hoard meds in case they do disappear. And just that mental health state of thinking my meds might go away, just affecting people so deeply. So obviously, we will keep an eye on that. Well, state legislatures are in full swing, and despite an actual, war abroad and the skyrocketing costs of living here in the U.S., state lawmakers are still finding time and prioritizing time to pass as much anti-LGBTQ plus legislation as possible. Here in Ohio, I must give him a shout out, Representative Josh Williams, who is a Black Republican who is on a tear. We currently have around 800 bills on the table here in Ohio. Josh Williams is one of 99 representatives, and yet he is responsible for sponsoring 100 of the 800 bills, which that is not 199th. I did the math, and they are one anti-LGBTQ bill after another. But I know that it's not just here in Ohio. Joe, what's going on in Tennessee?
things are getting taken even further in Tennessee. Lawmakers have advanced what critics are calling, the first trans watch list in any state legislature. It would force clinics to provide a list of gender affirming care that they will have to give to the state about personal patient data, including, age, treatment types, what kind of medications, and even like a public, which would be eventually become public, mental health history and detailed reporting on their health issues that is supposed to be protected under, federal law. So it's really astonishing, and it's quite blank targeting trans people and their medical suppliers. It's scary to see. Groups like the ACLU have constantly warned against it, and even surveillance government groups that are watchdogs, have pointed out that this is not normal, this is not right, and this is something that Congress specifically has passed legislation against doing. Like HIPAA is the privacy legislation should be protecting trans people from this, but they are still going forward and trying to make a watch list, and it's scary.
Yeah. Orion, what I always marvel at as I watch these hearings is, first of all, that both sides, and it's painful to even say that phrase in a journalism context, but both sides feel that they have the facts, and both sides feel these are the organizations, the medical organizations that side with us. And somewhere in the middle of all of this is the American Medical Association. And by the way, I've heard both Democrats and Republicans, in talking about gender affirming care, say that the American Medical Association agrees with them. Where is the American Medical Association in this whole conversation right now?
Oh, yeah. And thank you, Ken, because there's a lot of confusion about this. The American Medical Association and other medical groups have been under a lot of political pressure that's been pretty blatant and public, and things have just gotten really confusing. And, the AMA, American Medical Association, they support gender affirming care. They have been saying that publicly, at least for the past 10 years. But recently, things got really confusing, and it was like a whole saga. Listeners may have seen the New York Times story citing the AMA, and then subsequently the AMA responded by saying they were seeking a correction for the New York Times, and then the New York Times said, you guys never asked for a correction. It just a back and forth that kept on going, which has made confusion even worse. But to kind of just lay it out, the AMA said, I'm paraphrasing, that we don't support gender-affirming surgeries for trans youth. They made it clear that they still support gender-affirming care in general. They said this after the National Plastic Surgeons Group said something similar. The Plastic Surgeons Group said, we don't support surgeries for trans youth, but we don't think this care should be criminalized. The Plastic Surgeons Group said that right after a meeting with Dr. Oz, who has compared gender-affirming care to lobotomies. Dr. Oz, in January this year, he convened a group meeting with all of the lead medical organizations. After that meeting, Plastic Surgeons Group puts out a statement, and then the American Medical Association starts putting out statements. All the statements are a little bit confusing. People are getting confused about who agrees with what. And then the Trump administration celebrated the Plastic Surgeons Group announcement, saying that they're on the right side of history. But again, the Plastic Surgeons Group made it clear they don't agree with criminalization of the care, but the Trump administration is just maybe ignoring that part. And then at the very bottom of all of this, what everybody is missing is that WPATH, the International Authority on Trans Healthcare, also generally advises against surgeries for trans youth. However, the WPATH has a lot more to say about it, which is that it should be determined by doctors on a case-by-case basis, that if a doctor and their family and this youth do decide to move forward with a surgery, which is most likely going to be a mastectomy, they should understand reproductive side effects, they should be emotionally and cognitively mature, they should meet all these requirements. But in general, WPATH also cautions against these surgeries, which is something that I don't know if a single Republican in office knows that. So there's just a complete lack of understanding that has gotten kind of annoying. And now at the end of all of this, we have a group of 20 Republican attorneys general who are pushing for the American Medical Association to more broadly oppose gender-affirming care for trans youth. So that's the continuation of the political pressure we're seeing. anyway, it was just like a tangle of yarn that just keeps getting more tangled, and like nobody knows what anyone else is saying.
And it becomes a much different conversation if we take the talking point of surgeries off the table. If we are talking about gender affirming care more broadly, and we know that Republicans across the board use that as one of the biggest fear tactics that they can possibly use.
Also, the instances of the gender affirming care that leads to surgeries for people, aged 14 to 18 is extremely rare. Like there have been consistent studies that show that surgery is not what most trans kids are leaning to. That's not how they feel affirmed, which is why there's such a push on gender affirming care and the other methods. One study from Harvard said 2.1 per 100,000 people, not people, trans kids get surgery, which is an extremely tiny number compared to the amount of trans kids that are actually out there. So it almost seems to be like they're conflating an issue that isn't really there. They're not swaths of trans kids running around who are trying to find surgery or doctors trying to perform surgeries on trans kids. It's being built up for sure to provide a talking point.
And I also want to remind everyone that we are living in a timeline where Dr. Oz convenes a group of people and we talk about it. So that's a thing that we also have to somehow deal with. We're also living in a timeline where you all are listening to This News is So Gay. I'm your host, Ken Schneck from the Buckeye Flame. Joining me this week, Orion Rummler from the 19th and Joe Reberkenny from the Washington Blade. By the by, if you are not subscribed to This News is So Gay, what the heck are you waiting for? Subscribe to This News is So Gay right this very second on your favorite podcasting app so that new episodes automatically make their way to you. Well, it is time, folks. It is time for Glitter Bomb. This is where our roundtable shares stories of queer joy that they are seeing covered out there in the news. So let's set off that weekly Glitter Bomb. Orion, let's start with you. Give us a story of queer joy in the news that you want us to know about. And just so listeners know, Orion is already smiling, so I'm excited.
Yes, I'm very biased about this, but my partner, Ryan, produced a little play this past weekend, a queer bar in DC called As You Are, and it was absolutely ridiculous. It was kind of like if the cast of Monty Python were all gay trans people. It was called Meemaw Saves Easter, and it's just like a 2-hour-long fever dream where someone's grandma gets sent back in time to convince Jesus to get crucified. But instead, like Judas and Jesus run away together because they're in gay love. So it was really ridiculous. And my partner has been working on that for like months. And having a community theater production going on for the past couple months has made our house very interesting. So what's giving me joy these days is all the weird queer and trans art people are making.
Yes.
Whether it's in the shadows or on the stage.
As a gay Jew from New Jersey, I thought that was the way the Jesus story ended, but I guess I should do some reading up on that. Joe, give us a story of queer joy that you want us to know about.
Yeah, so I am a huge Slater fan, mostly because my gay roommate is always playing Slater, and she just released her third studio album, Worst Girl in America. She is bisexual, and it is one of the best dance albums I've heard this year. The first 6 tracks are non-skips and will always put me in a better mood. They're a little bit louder, they're like hyperpop dancey, but it is something that I have been super grateful over the past 2 weeks. A bunch of gay bars are doing now Slater-themed nights. Trade, which is here in DC, that is a bar I frequent and love. They did a huge dance party that was Slater-themed. One of my friends came in a little wig, and there was a line around the corner. It was just to see all the twinks and the dolls dancing to Slater. Really, it was fantastic, and it's something that I look forward to doing again this weekend.
How much street cred do I lose for having absolutely no idea who Slater is?
Ryan, do you have any thoughts?
I think it's fine because she's still pretty early in like getting like I don't think it's kind of like before everybody knew about Charlie XCX. Like I think it's like she's huge for like a core part of the gays, but I don't think she's gotten big outside of that. Do you agree, Joe?
I do agree. She's like indie sleaze is one of the things that everybody says when they talk about her, and it's very niche right now. But I anticipate her to be blowing up very similarly to Charlie XCX very soon.
Okay, well, if anyone wants to have a conversation about AC Slater from Saved by the Bell, I'm down and I'm ready to go. But finally, for those attending Coachella, but only those attending Coachella, they will be able to order Starbucks' Unicorn Frappuccino, widely regarded as that brand's gayest ever drink. And thus, I must ask for our quick queer culture question for this week. What is your gay drink of choice? Joe, what are we drinking? What's our gay drink of choice?
I got to go classic vodka soda.
There it is. All right. Orion?
I like a good stout. Technically, I've heard that IPA is like the lesbian drink, but I feel like stout is also... Anyway, I drink beer and wine mostly. I mean, a fun fact is like a lot of trans guys really crave orange juice right after when they start testosterone, which was a while ago for me. So there was a point in time where I was working at my desk and I literally had like a full gallon of like orange juice at my desk, and I was just like really going for it with the orange juice. So that's my fun fact.
It's good to know. I can get Alexandra Smith to add a budget line for orange juice there at the 19th. You let me know. I am in good with her. Well, we certainly want to hear what you both are working on. Orion, what's coming up for you at the 19th?
Yeah, well, I'm really excited. We're working on a project that's related to the United States 250th anniversary. I actually don't know if I'm allowed to like say anything else about it. But we're announcing it soon. It's going to be really fun. I am contributing to the project. I think it'll be very fun and revolutionary.
I'm excited. That is a tease if ever I've heard one. Joe, what do you got coming up in addition to, everything?
Yeah. One story I'm really excited about is drag queen Tara Dickoff from Boston. I am interviewing her about her whole transition from being a journalist working at Media Matters to now being a super popular online queer voice and advocate in, a totally different field, yet still amplifying queer voices. I'm really excited. That's set for later this week. I've got an interview that's supposed to be coming, knock on wood, with Nancy Pelosi in time for Pride Month, and just a bunch of everything else coming out of the White House, the Supreme Court, and the Congress. Just it's a deluge, but I'm excited to be covering it.
Oh my gosh! Well, I say the three of us just go together to go see Slater. I'm excited. Is that a thing? Can we do that?
I'd be down. She just performed at Coachella as well, so it fits.
It fits. It fits. Well, my friends, that is all the time that we have for this week, and I want to thank our roundtable. Orion Rummler, always a treat to have you on the pod.
Thanks so much, Ken. Love it.
And Joe Reberkenny, I felt way less hate crimed by you this time around, so I appreciate that.
Thank you. Yeah, I will go watch Saved by the Bell, right? That was a Slater reference you made, which I have not
Slater.
Seen. I have not seen that show, so you've got one on me.
I literally just said you have not hate crimed me, and then you turned it around in the last 3 seconds.
I had to, yeah. I got to set a precedence, right? To just be, no, I'm kidding.
I love it. We love a narrative thread. Thanks to both of you for everything that you're doing. I'm Ken Schneck, editor of the Buckeye Flame, and if you liked this episode of This News is So Gay, please share it with a friend. Subscribe so that you do not miss out on our next episode. Send an email on over to editor@thebuckeyeflame.com. That's me, to let us know your thoughts. And of course, rate and review us on your favorite podcasting app. This News is So Gay is a product of the Buckeye Flame, a nonprofit newsroom. Become a recurring donor today for as little as $12.50 a month, which truly enables programming like this from our scrappy, queer nonprofit newsroom. In the meantime, read LGBTQ+ news, share the stories from LGBTQ+ reporters, and support the work of LGBTQ+ newsrooms. Until next week, friends.